So we have the opportunity to bring together this wonderful coalition, broad coalition of people from many different sectors of the Philippines to come together around the concept of compassionate pragmatism. The question of why are we so limited in our ability to be helpful to the overwhelming majority of people that struggle with drug and alcohol problems. It's not just in the Philippines, it's not just in the United States, it's a global issue. So this is sort of the proposition that I'm going to share with you ideas and strategies that I've gathered together in an attempt to come up with a framework that can enable us all to be more helpful. And I'm sharing this with you as a group of experts. But I think it's also important to consider something that I've come to believe in, is that if we're going to change our practices, we need to be willing to change our thinking. I think our old practices were based on old models for understanding addiction and problematic substance use. Those practices have not been very effective. They've been limited in their effectiveness. And so what I'm going to present is a new framework that I call a psychobiosocial framework, that I think is a model that can bring together and help us understand how many, many different factors, variables, forces come together in ways that are unique for each person, giving rise to that addictive experience and behavior. I think that we can consider that any moment, any interaction with a potential client has a therapeutic potential, so that how we interact from the first contact, the phone call that's inquiring about help, how the security person meets that person at the door. All of the support staff can work with some of these principles and practices, all the way to the folks that are actually doing full-on psychotherapy or counseling. So that's an idea that I'd like us to be considering together. Finally, I want to say that I've had the honor and the privilege to offer trainings and workshops and talks in 16 countries around the world and many places around the United States. So if some of this material resonates with you and you have feel some kinship with it, then you are today joining a global community of compassionate, heart-centered people that are committed to expanding our reach to the majority of problematic drug users that we haven't been able to be very helpful with. So with that, I'll get into my slides. So compassionate pragmatism is an idea that was developed by one of my major mentors, teachers, and ultimately good friends, Alan Marland. And this is what he said, that Alan's vision that alcohol and drug prevention and treatment services should meet people where they are with evidence-based programs delivered with empathy and acceptance. That kind of captures it. There's an empathic acceptance that's grounded in empirical science, evidence. And as I said, I think the philosophy is embodied in harm reduction practice. So this comes from a lot of different places, but essentially it seems that compassion is a feeling, a desire, a motivation to help relieve the suffering of another. It's a feeling, and it's grounded in emotions. But we might also say that when we consider ideals like justice and fairness and interdependence, it also has a kind of rational basis. That is that rationally, if we are all interdependent, the suffering of another affects us and those that we love. And so that can inspire a compassionate response. Now, pragmatism is the idea that we need to evaluate our theories, our ideas, and our practices based on the outcomes, their practical application. so that we need to be continually testing their usefulness, workability, practicality, to determine whether they're any good. And this is both the basis of science, and I think this is the basis of good clinical practice. Is this helpful? Is this policy helpful? Is this clinical practice helpful? And so that question of how's it working can really invite an exploration on many, many levels, so that we can collaboratively work together to come up with better solutions, more effective solutions. So harm reduction, as I said, embodies compassionate pragmatism. The essential shift in harm reduction practice is from abstinence only to any reduction in drug-related harm. That is a profoundly important thing to understand, because the world has been dominated by an abstinence-only presumption. But what percentage of people that are struggling are ready to commit or able to commit to abstinence at the point of initial contact? So that enables us to work with people around safer use, reduced use, and abstinence, to the extent that that is a goal that the person is embracing.